So oftentimes if we're discussing a vasectomy with a patient, we'd like to meet them the first time. Sometimes we'll offer the vasectomy at that time if the patient's comfortable with proceeding and there's no other barriers to proceeding with the vasectomy. If they'd like to wait, we can certainly offer that as well. So we try to be comprehensive in our approach to offering sterility to men. A vasectomy is fairly quick for the patient. They are brought into our procedure room, they lay down on the table, and we make a small opening in the skin of the scrotum and cut, clip, and cauterize the tube that takes sperm to the outside world. And all that together takes about 15 minutes or so. The recovery process for men after a vasectomy is pretty benign. It usually takes a couple of days. Some men, if we perform this on a Thursday, will take Friday off from work, recover over the weekend, and be back to work on Monday. With a vasectomy, the risk of bleeding or infection is exceptionally low. It's less than 1%, so it's a very safe procedure. So after a vasectomy, you might have some discomfort, like a dull ache in the scrotum after some of the numbing medicine wears off. This usually resolves in the next couple of days. Less than 1% of men will have what's called a post-vasectomy pain syndrome, which will be persistent discomfort, which we can certainly evaluate and treat. So there's about 500,000 vasectomies that are performed each year in the United States, and about 6% of those men will undergo a vasectomy reversal. So it can be done. Sometimes it can be a little more difficult the farther out it is from their vasectomy. However, we offer vasectomy reversals to all men who are interested at the University of Florida. So the success rate for a vasectomy is exceptionally high. The failure rate is 1 in 2,000 men, so it's very low. A follow-up appointment is usually done in 3 months. It's not necessarily done in the office, but we have men get a semen analysis, make sure that they're completely sterile at that time, because 1 in 2,000 men will still have sperm in the ejaculate afterwards, and we don't want those men to have any happy accidents.